Good morning, everyone. This is Meng Li from Delft University of Technology. Now I'm presenting a collaborative project between TU Delft Catharina Hospital and Tilburg University. This study evaluated usability and presence of virtuality operating room simulator during laparoscopic surgery training. As we know, laparoscopic surgery received a lot attention recently due to their benefit versus open surgery. For example, less pain and bleeding, shorter hospital stay, and quicker recovery. They are also one of the most developing field of the surgery area. For example, the cholecystectomy is now as a standard procedure, and the robotic surgery is the most advancing field of the laparoscopic surgery. The laparoscopic surgery requires different skills than the open surgery. For example, they are operated under restricted hand movements, narrow field of view, non-intuitive hand-eye coordination, and ever-changing instrument. Within the operating room, there are different kinds of distractions, so the surgeons also need self-management throughout the procedure. Thanks to the introduction of virtuality surgical simulators, the surgeons are able to improve laparoscopic skills without subjecting the patients to unnecessary skill or pain. We can see there is a trend of this kind of VR training, from psychomotor skills to procedure skills and to training within the full context of the OR. There is another trend shows on top of this image is from non-immersive application to highly immersive application.
I can see my instruments in front of me. I can see my assisting nurse to my left. I can see my assistant on the right. I can see my anesthetist sitting behind me. Now I'm going to see my pedals in place. I'm going to select my instrument using the tool. And I also get a feedback from my nurse confirming the instrument I've just selected. Okay, select a monocular hook.
The VR setup we applied comprised three components in this study: a VR laparoscopic simulator, a VR headset, and a virtual OR environment. It is because the main drawback of current VR laparoscopic simulator is lack of true representation of the operating theater experience. The most VR laparoscopic simulator use a 2D display that replicates the tasks, but not the busy and chaotic environment. And in this study, we simulated different kinds of distractions. For example, there are three most often occurring distractions, such as door open, radio, and phone calling. And as well as one most distracting one is case-related communication. Previous studies have reviewed the face validity and users' preference of immersive VR laparoscopic simulators, but how intuitively and professionally user can utilize a virtual OR simulator to achieve their objectives is still unknown. Therefore, the focus of this study is to investigate usability and presence to identify the potential benefit and improvement opportunities of the virtual operating room. So we are evaluate these factors from three aspects of ergonomics. In this study, we using presence questionnaire, localized procedure, discomfort form, questionnaire for intuitive use, and NASA TLX to identify the physical and cognitive ergonomics. And for the organizational ergonomics, we are using interviews. Invited 29 surgical trainees and 8 surgeons to participate in this study. In this study, we referred the surgical trainees as novice and surgeons as expert. Among our participants, there are 12 persons had experience on VR or AR technologies. We told the participant the purpose of this study is to investigate the use of VOR in the surgical training. And then they need to complete a hand-on task in VOR and in 50 minutes. If they cannot finish this in this time duration, they can stop because the focus of this study is not on their performance. From the result of usability, we find out that the VOR appeared intuitive and satisfying to perform laparoscopic procedure training. For example, for intuitive use, the achievement of goals are perceived as high and the error rate are low. Both of them are related with effective interaction. And the effort of learning is low, and it is associated with the previous knowledge for the first time of use. The mental load level are moderate, among which the mental demand and effort are the most influential factors for both expert and the novice, and the frustration are the lowest level. The differences between the novice and the expert is that they have a higher mental demand, effort, physical demand, and temporal demand than the expert. Localize the postural discomfort. We can see that the participant only experience this very little discomfort on 7 body segments like this. And for the unsupportive discomfort, we categorize the rate for more than 2 points according to ISO standard, and we find out the left hand, the neck, and both eyes are experienced this kind of discomfort. We can see that the self-evaluation of performance is the most important factors for a higher presence of VOR, which are including how quickly the users can adjust to the experience and how efficient in moving and interacting by the end of this experience. And for the least contributed factors are the quality of interface. Among them, the visual display quality and the handhold of the simulator are rated at the lowest for all the participants. In interviews, we can aggregate general feedbacks about the VOR. Most participants perceive themselves as physically presented in a real OR, and they are highly engaged throughout the procedure. Talks and sounds enhanced their experience of the presence, and especially for the trainees, they were excited to complete the task. Improving user interface is the main demand of the VOR improvement. We can see that the participant with corrected vision either have the problem to see a clear image or have the difficulties to put on the VR headset on top of their glasses. And sometimes the headset can even press on the glasses and cause pain. And also the low graphic resolution is reported. And for the torque and for the haptic feedback, the most important problem is the low haptic resistance and the delay in changing instrument. Our environment is critical to increase presence. For the VR setup, most participants notice their body part, for example, their feet are missing within the VOR. And the incorrect OR layout, disproportionate element, and unrealistic rendering also cause the unrealistic experience. And for the surgery steps, they have in real OR slight differences, but the steps in the VOR seem to be more rigid. Is expected. Many participants noticed that the virtual instructor repeated the task they have already performed. It makes them feel confusing. And in the real OR, an assistant will follow the surgeon's movement to change the camera, but this part is missing in the VOR. And for the mood aspect, the communication was impersonal and need add some emotion. And the team was also motionless, and in the reality, the team could usually move around, even if it's just slight. The last one is the needs for personalization. For example, some participants ignore the instruction because they find another person's name was called. And usually some participants expect to communicate with their own native language. We can see that the sound and the language part is the important aspect for personalization. The results of this study, we learned advantages and improvements of the VOR. The immersive training via VR headset heightens the motivation of the trainees. The VR surgical training demonstrated good sense of usability and presence. The increased mental workload creates a beneficial condition for novice perform better in a real-world environment. There are 4 improvements found in this study. User interface improvements are the most salient requirement, and more realistic environmental setup via panoramic and volumetric videos. Immersive team interaction will mimic mental distractions and enrich experience via personalization. 3 limitations of our study. We avoid comparing the VOR with either regular VR laparoscopic simulator or real surgery. Secondly, that current study just applied the self-assessment of performance, but we will incorporate the objective assessment in the future study. And besides that, the different type of distractions will also be compared in the future study. In general, VOR demonstrated a new dimension in providing immersive training during a laparoscopic simulation, and 4 improvements mentioned above would increase the effectiveness of the VOR and boost the motivation and speed up the process of adaptation of the trainees as well. That's all for my presentation. Thank you for your attention.